Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We are a health system with 3 academic medical centers. Our AMC status means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. Throughout this podcast, we will discuss our health system service lines and the innovative work our doctors and professionals are doing to improve treatments and the patient experience, highlight our academic partnerships, and the importance of creating collaborative relationships between health systems and educational institutions, explore trending topics in the world of health today and what they might mean for the future of healthcare. I'm your host, Kristen Gladney, Chief Wellness Officer. And today we're joined by Devin Brittain, a registered dietitian working at University Medical Center New Orleans Cancer Center. Welcome, Devin.
Hi, thanks for having me.
So, Devin, I'm going to jump right in. March is National Nutrition Month, and the 2025 Dietary Guidelines for Americans were just released just a few months ago in January. Let's talk about the process of releasing these guidelines. Who weighs in on them? What do they mean? What do they drive in healthcare? Tell me a little bit about all of that.
Yeah, absolutely. So there is a process when developing these guidelines. There is also an advisory committee that really does the joint work. So starting off, your dietary guidelines are a combination of being from the USDA, the U.S. Department of Agriculture, and the U.S. Department of Health and Human Sciences. Within that, they have an advisory board that is made up of different experts, including PhDs, some dietitians, some different research specialists, some different areas of experts in relation to health and nutrition.
So what we should take away is that there are experts who weigh in, evaluate science, and then develop these guidelines every 5 years for Americans to follow and really implement in their dietary habits.
Yes, we should also be in consideration that just because they are an expert does not mean that they don't also have other things that they should be disclosing. So in the dietary guidelines, there's actually a form that lists what kind of other financial benefits or ties these experts have to things that might have a conflict of interest. So that's going to include some people having ties to our beef, our dairy councils, our pork council, General Mills, different pharmaceutical companies. So all of that information is also disclosed when we talk about the big picture of our guidelines.
So some transparency there.
Yep.
That's pretty cool. That's great. So interesting, in the new guidelines, the mantra, the theme is eat real food. I think there's a lot to unpack there. So let's talk about that. So tell me, what exactly does that mean in the dietary guidelines? Eat real food.
Yeah, so eating real food is doing just that. It's relying on eating mostly from our 5 main food groups. So we want to have a diet that's rich in our fruits, our vegetables, our dairy alternatives, and our grains, specifically relying more so on our whole grains.
So would it be fair to say that real food just means minimally processed?
Yes.
Okay. I think that's helpful for people to understand that, food is real. Even if you buy it off of a shelf, it's real. But it just might mean we want you to eat foods that have less sodium, less preservatives.
Yes.
Perfect. So when we talk about, overly processed foods, the guidelines do explicitly advise avoiding overly processed foods. And this is the first time that it's kind of spelled out in this way. And we are in a society, especially, here in the South, and we're busy people and we like convenient, sometimes processed foods. So how do we make, healthy choices while considering removing overly processed foods?
So this is a dual-layered question. One, because some of our processed foods go through a process that actually help nourish our bodies. An example of that is some of our cereals. Once they've gone through the process of being packaged, they add back in some vitamin B, some of those different micronutrients that we lose when we're producing them. But on the flip side of that, you also have some of those highly processed foods like picture all of our really sweet added and cookies and beverages and chips and some of the different snacks that just don't really have much nourishment to them. They're not necessarily what we call being nutrient dense. Nutrient dense meaning that they have a lot of your protein, or they have maybe your carbohydrates, your fat, your different micronutrients that your body relies on to feel well. And a lot of these overly processed foods don't have necessarily those things in them. That being said, when we're looking to navigate how do we implement more real food into our diet, we're really looking at what kind of snacks are more convenient for us. Maybe we're opting to do something along the lines of making our fresh fruits and vegetables more easily accessible, ready to grab, so that we can take them on the go to wherever we're eating.
Yeah. So how do you help your patients, for example, figure out, is this an overly processed food that I should choose, or is there a better option for me?
Yeah. One of the first things I love to do with my patients is making sure that they understand how to read the nutrition label. I feel like that's something that a lot of us don't necessarily have the skills for, but all of the information we need to know about the food is actually on that label. So that's a great place to start. Within the food label, we're looking at not only the serving size, but also how many calories there are in a serving. We're also looking at the breakdown of the percentage of, are there any additional added sugars? What is the sodium content in it? As well as what are the ingredients? The ingredients are going to be listed as to what is the most used ingredient to what is the less amount used in the label. So that's a good indicator of being able to tell what's in the food versus not.
Yeah, and a lot of times in overly processed food, sodium is going to be a good indicator. If it's a high sodium content, oh wait, maybe this is overly processed.
Yes, and a good indicator for that, I'm usually telling my patients we're looking for something that's 3% or less on that nutrition label as a good starting guideline for being lower in salt.
Yeah, perfect. I think that's helpful. Now, another, interesting part of the new guidelines are that they emphasize animal proteins and full-fat dairy. So kind of a transition from what we've seen before where low-fat dairy was really encouraged for anyone over 2 years old. So, tell me a little about what your thoughts are on the significant increase in the recommended protein intake and that choice of full-fat dairy.
This is one of the guidelines within the new starting points that I don't necessarily agree on. There is backing, about 50 years worth of backing, that following more of a low-fat diet is actually beneficial to helping to prevent some of those different chronic diseases. We're talking our diabetes, our heart disease, just general chronic obesity. Those are some of the things that we're concerned about. And so encouraging a more full-fat diet is not necessarily helping, but actually hindering the idea of some of the health that we talk about when we have such a good backing to why we want to limit our fat consumption.
Yeah, and I think it's important that every person start to inform yourself through reading the label, as you talked about, through really understanding, is there a benefit to this for me? Why should I choose this? Why should I not? Could I just continue? And have a conversation with your doctor, with a dietitian, right? Dietitians are the food and nutrition experts. So if this is complex, then somebody like you would be the person that we would absolutely go to help navigate these challenges.
And, that's not to say that there's are indications where we might want to be doing a whole milk instead of doing your low-fat options. There's some times where we need to look at you getting a little bit more of your extra fat content in to help nourish your diet in a different way. But that's something that's going to be a lot more individualized when you're talking with your healthcare provider, your doctor, your dietitian, whoever it might be.
Yeah. And, a key thing I think for viewers to remember is that anything that comes from an animal is going to have more cholesterol, more saturated fat, more of the things that really don't help contribute to heart health. So it's just important to now be aware that this recommendation is here, but that could mean that you start to intake other things that might not be so great for you.
Yes.
So very individualized. And along those same lines, butter, beef tallow, all things that are now being offered right along with olive oil, which we know is a plant-based oil, which is going to have less of those, fats that might be harmful. And it does talk about limiting to 10% of saturated fat. So how do we balance that? Like when we think about throughout a day and we're going to be eating, how are we going to balance to make sure that we're not over consuming those types of fats?
I do want to say the 10% of saturated fats being limited, that has not changed. That has always been one of the recommendations. Where we're concerned is now if we're looking at also adding in getting some of that 10% fat from your beef tallow or from your butters, in addition to doing your whole fat milk. If you're getting 3 cups of whole fat milk in, that's already pretty close to your 10% of that saturated fat. Then if we add on just like a tablespoon of your butter or your beef tallow, you're going to be over the 10% recommendation. So it is important to keep that in mind, where we can incorporate having some butter here or some beef tallow in some of those nice different culturally welcomed dishes that have it. But we also want to keep in mind that we can make some certain swaps where we're using something that's going to be a lot more unsaturated, like your olive oils or some of your different seed oils, your canola oils that are available that we know are going to allow for a less saturated, heavy diet.
Yeah. I think as registered dietitians, we always focus on moderation, diversity of food sources. So when I think of a pantry or refrigerator, I think of having a bottle of olive oil, having a stick of butter, having all those things and using them when appropriate, but still in moderation so that you're not over consuming one or the other.
Yes.
And that will help.
Moderation is absolutely key.
Yeah. Another thing to talk about moderation is sugar, right? So sugar is one of those nutrients that is, it kind of remains at the top of everybody's mind when you think about healthy eating. And this year, the recommendation is added sugar is now 10 grams per meal for adults. So when we think about that, first of all, tell us, when we think about 10 grams of sugar, what is that in real life?
It's not much at all if we're looking in small doses and things like that. Easily, when we're talking about that in real life, any of your sugar sweetened beverages are already way out of that 10 grams of added sugar.
So if I'm having a can of soda, regular size can of soda, am I going to consume more than 10 grams?
Yes.
So what are some of those other hidden sugar bombs that we have to think about and really start to say, oh, wait, if we're thinking about this limitation or this 10 grams per meal, we should pay attention to these?
Yeah, so that goes back to some of our ultra-processed foods. Looking at that food label, it's going to actually have a section in your food label that's going to say the number of added sugars. And it's important to note just not the amount of added sugars, but the serving size. If you're eating a whole pack of Oreos, you might be eating way more than those 10 grams of added sugars, but maybe the portion size itself might be 1, or you might be able to eat just a small amount and be able to manipulate the number from there. There's other foods that we don't necessarily think on that we might classify as being more healthy that can also fall into this category. So think about some of your different black teas, sweet teas, green teas that are already produced on the shelf. It's going to be better for you to make those things at home and then be able to add in your own non-sugar sweetener or just a little bit of your other sweetener so that you have control over that. Some of your different yogurts, a lot of them can end up adding in a bunch of added sugar rather than just being a baseline yogurt. So you always want to be referring back to the label and what the label says in regards to how much added sugar is in there, what is right for me, and what is the best decision I can make for myself as well as my family and friends.
Yeah, I love how you keep going back to the label. And I always tell people, we don't put any kind of gas in your car. Like, you don't pull up and pull off the diesel pump and start pumping gas. You read the label, you make sure you're putting the right thing in to fuel the car. We should be doing the same thing to fuel our bodies. And
Exactly.
It's the answers to the test are on the label. So something else more striking is there's a 0 sugar rule for early childhood. So how realistic is this? I think about as a mom, my kids would go to daycare or they'd go to the store and they'd get a lollipop, and 0 sugar is hard as a mom. So help us understand, do you think this is realistic? Are there implications maybe outside of even nutritional implications, social implications? What are some of the things we have to think about with this?
Yeah. Realistically, I do not think 0 sugar is going to be feasible in our current society. And I think it's actually might be a little dangerous. I agree that we should be really focusing on limiting our sugar, particularly our added sugars. Those should be limited, but they should not be completely restricted to the point where we're making those food items almost dangerous or giving them a label that might lead somebody to start sneaking those items, we're really starting to cause some unhealthy habits or disordered eating habits that we don't want to encourage for these children. Your ages 0 to 5, that's a very monumental moment in development for these children. And so it's a great time for us to start building what healthy diets look like, as well as how do we incorporate some of those sugar treats here and there, but not overdoing it. So we don't want to make it a no forbidden item. We can't have it in the household, but also we don't want it to be we want to eat as much as we want to have. We want to make a point to make sure that we're focusing on eating from our first 5 food groups, having a balanced meal, then we're having a right portion of whatever that added sweet treat, whatever it might be.
Yeah, birthday cake, if it's your birthday, is perfectly fine.
Yeah, birthday, king cake when it was in season, right? All of those things are going to be okay, but we want to always make sure that we're having it with other foods and we're not necessarily forbidding it as an option. We're regulating it in the right portion and we're having healthy dialogue and conversations with your children, with your family members about why we might be having one food over the other.
And up until this point, we've kind of talked about restriction. We talked about the 10% for saturated fat, the 0 sugar now. But when it comes to alcohol, that got a little bit more lenient, actually. So we went from 2 drinks for men, 1 for women, to broader, just consume less alcohol for better health. So does that give us an indication that, moderate drinking has fundamentally changed? How do we interpret that? And how do we implement that in our own lives, especially in New Orleans, where we have a cocktail culture?
I think it's important to still refer back to our original, more specific guidelines. There's a lot of research that connects alcohol as being a carcinogen, as causing a lot of problems in different chronic diseases, from liver disease to kidney failures to things like that we want to be concerned about. In a culture that really builds on alcohol, I also see that we're starting to see a little bit more of a switch from alcohol to it being more socially appropriate to go out and order yourself a mocktail that doesn't have alcohol in it. So leaning into those options of being aware that alcohol has a place and, we really focus on it socially, but also we're changing the terms and where socially comes and allowing a space for people to choose to drink or not drink and it be acceptable.
Yeah, it's funny you say that. I was just, getting a text message from a friend that there's this new dance club that does not serve alcohol. And their mantra is basically like fun that you won't regret tomorrow. So I think there's the shift in culture, a place for everyone to make a decision that's comfortable for them with or without alcohol. So this is interesting kind of at the same time that we're getting this, just more general recommendation. So again, I think it goes back to personalized decisions, moderation, and then support from your physician or your dietitian based on your particular situation.
Absolutely. It's always going to go back to these are general guidelines for healthy Americans. However, you should always be wanting to tailor that conversation to you personally, as well as having a plan in place with your providers, with your dietitians, with the healthcare team that you have.
When we think about these guidelines, how do we apply them when we think about preventing chronic diseases like diabetes and heart disease? And we know that they are so prevalent in our area. And historically, these guidelines have really been kind of the guidebook on how do I manage my disease? How do I prevent it? How do I stay healthy? So talk about how these guidelines play a role.
So again, these guidelines, they have the things that we want to question a little bit more, but they also have some of the things that are true and true. That being that Americans still do not get enough fiber in their day-to-day life. And that's why we want to be focusing on eating more of our fruits and vegetables and our whole grains, because we really need to have that high fiber diet to help with these chronic diseases. Your high fiber diet, focusing on eating more plant forward, so to speak, allows us to help lower our risk for diabetes, for heart disease, for certain cancers as well. It's really important that we're choosing to eat a versatile and rich diet that is including a lot of our fruits, vegetables, grains, things like that.
Yeah, eating the rainbow.
Eat the rainbow.
So we're coming to the end of our podcast, and this has been a great discussion, very interesting. And we always end by asking our guests, what do they do to keep themselves well? So I'll ask you that question first, and then I got a follow-up for you. So tell us, how do you keep yourself well?
I love to dance. So that is one of my favorite go-to things. I'm actually coming off of having danced in a bunch of parades over the Mardi Gras season with my dance crew, Voulez Crew. I'm also involved in our Latin dance scene here. So I'll be salsa dancing, I'll be bachataing here and there. I think dance is a great way to bring a lot more joy into your day, and it's something that's free. You can just put on some music and have a dance party in your kitchen, in your living room. You can invite friends over. I think it's a great way to get your heart beating, literally, and to just have some more fun and to embrace being well.
I love that. I love that. Bringing joy. And since we're focusing on nutrition, it's National Nutrition Month. You're a dietitian. I'm a dietitian. Tell us, what are some of the hacks that you have? What are your favorite tricks to make sure that you have some little healthy swaps here and there?
By far, one of my favorite food hacks or trends that's still kind of going on in the social media scene is taking advantage of Greek yogurt. So Greek yogurt, it's going to be lower in fat, a lot higher in protein, really low in that added sugar, and it can be used as a substitute for so many different things. So I don't have to have sour cream, mayo. I can use it in baking. I used it just the other day on my chicken as a way to help coat my seasonings. So it's one item that I'm purchasing for maybe $4, a big container of it, and I'm able to use it to dollop on my potatoes. I'm using it as a parfait in my overnight oats. I'm using it in all kinds of different ways, and I'm getting a great amount of protein from it, a lot of good, healthy gut bacteria as well. And I just overall feel great. So if nothing else, that's been my current hack, is how much I love Greek yogurt and want to tell everybody about it.
That's awesome. So remember that Greek yogurt, go read the new dietary guidelines. They're good for 5 years, so they're going to be around. And make sure that you reach out to a local registered dietitian like Devin in the community who can help you navigate some of these challenging food swaps. But just remember, eat healthy, choose fresh foods, and do the best that you can.
Yep.
Right?
And don't forget to drink your water.
That's right. So thank you again for joining us today, Devin. And thank you all for listening. Join us as we go beyond extraordinary on the second Tuesday of every month.